Assalamu alaikum. Bismillahirrahmanirrahim. Work hard in silence, let success be your noise. My topic of presentation is trachoma, learning outline. In this presentation, I will introduce you to trachoma. We are going to discuss the epidemiological triad, chain of transmission, levels of prevention, and recent advances. At the end of this presentation, you will be able to describe epidemiological triad, prevention aspects, and recent advances regarding trachoma. Introduction. Trachoma is a Greek word which means rough. Chlamydia trachomatis, which is the organism responsible for causing trachoma, causes infection of eye, which is known as trachoma, and is leading infectious cause of blindness worldwide. Discussing the global prevalence. Trachoma is still endemic in some of the world's poorest populations. Africa is the most affected continent, and this disease is also found in Asia, South America, Australia, and Middle East. On the right side, you can see an area map in which dark green color shows that trachoma is still endemic in these countries, and Africa is the most affected continent, and Pakistan is also included in this area where trachoma is still endemic. Epidemiological situation, it is a public health problem in 44 countries worldwide. An estimated 2.2 million people are visually impaired as a result of trachoma, of whom 1.2 million are blind. More than 21 million have active trachoma, and about 7.3 million require surgery for trachomatous trichiasis. Now, the economic impact of this disease is immense. The burden of trachoma on affected individuals and communities is enormous. The economic cost in terms of productivity from blindness and visual impairment is estimated at US dollar 2.9 to 5.3 billion annually, increasing to US dollar 8 billion when trichiasis is included. Now let's discuss the epidemiological triad, which includes agent, host, and the environment. Agent. Agent responsible is known as Chlamydia trachomatis, which is a gram-negative bacteria. And this bacteria is different from the other bacteria in a sense that it is obligate intracellular bacteria. It lives in the cytoplasm of epithelial cell, and it replicates there. Now discussing the serotypes. Chlamydia trachomatis has further serotypes A, B, BA, and C, which are responsible for hyperendemic trachoma. And transmission of these serotypes is from eye to eye. And the other serotypes are D to K, which cause paratrachoma, neonatal and adult inclusion conjunctivitis, and the route of transmission is from genitals to eye. In this lecture, we are going to focus on this hyperendemic trachoma, which is caused by A, BA, B, and C. Host factors. All ages are susceptible, but this disease is more common in children from 2 to 5 years of age. Gender. Both males and females are susceptible, but prevalence is more in adult females as compared to males. This is because of more interaction of females with the children. Environmental factors. Inadequate hygiene, crowded households, inadequate access to water, inadequate access to use of sanitation are the environmental factors. And it has been seen when the community is supplied with safe drinking water, the incidence of this disease decreases. Other factors are poor hygiene, poverty, and flies increase the risk of transmission. Reservoir. There is no known animal reservoir Cases with active disease or chronic infection are the reservoir of this infection. Source of infection. The most common source of infection is the ocular discharges, which cause direct contact. Other less common are the vectors such as flies, which are responsible in transmission of this disease, and formites also can cause transmission of chlamydia trachomatis, which include towels, handkerchiefs, sheared surma, and kajals and other eye pencils. Incubation period of this disease is from 5 to 12 days usually. Now let's discuss the levels of prevention, which include primary, secondary and the tertiary level. Primary prevention includes health promotion and specific protection. Health promotion. We can do health education about the disease and its modes of transmission. We can encourage frequent hand washing and face cleaning, improved hygiene, improved water supply and sanitation, and fly and vector control. Secondary prevention includes early diagnosis and prompt treatment. This disease is usually diagnosed clinically, and people are examined for clinical signs through the use of magnifier. Symptoms of disease are foreign body sensation or slight stickiness in the eye. Now let's discuss the signs of this disease. Conjunctivitis. Conjunctiva is a layer which covers the eye, and it has two parts: the bulbar part, which covers the eye, and the palpebral part, which covers the lids. And in conjunctivitis, there is congestion and conjunctival follicles. These are lymphoid aggregates, and they are diagnostic of trachoma. If these aggregates are present, we can clinically diagnose the trachoma. Then, if the disease progressed, then corneal signs are seen, which include superficial keratitis, which is the infection of cornea. Herbert's follicle are seen at the limbus. And then comes the stage of progressive pannus, which is a vascularized growth on the cornea. And at the margin of this growth, there can be corneal ulcers. Last are the lid signs, which includes trichiasis, which is the introversion of the eyelid, and entropion, in which eyelids fold inward. This disease, stage requires corrective surgery, and if not treated on time, this can lead to blindness. WHO has also developed a grading system for trachoma, in which trachomatous inflammation follicular is the first stage, the presence of 5 or more follicles in the upper tarsal conjunctiva, and follicles are round swellings that are pale than surrounding conjunctiva, and follicles must be at least 0.5 millimeter in diameter. Then comes a stage of trachomatous inflammation. There is pronounced inflammatory thickening of the tarsal conjunctiva that obscures more than half of the normal deep tarsal vessels. Then trachomatous scarring. The presence of scarring in the tarsal conjunctiva scars can be easily seen as white lines, bands, or sheets in tarsal conjunctiva. Then comes the trachomatous trichiasis. At least one eyelash rubs on the eyeball, and in corneal opacity, the pupil margin is blurred and when viewed through the opacity. Then laboratory diagnosis. Although this disease is diagnosed more often clinically, but lab diagnosis such as conjunctival cytology can be done. Detection of inclusion body. As this bacteria lives in the cytoplasm of epithelial cell, there are intracytoplasmic inclusion bodies on the microscopy. We can do ELISA, and isolation of chlamydia can be done on as this can be grown on a culture medium. Treatment. Antibiotics are used to treat this disease, topical or systematic antibiotics, but Topical antibiotics are preferred as they are cost effective, easy to use, have fewer side effects. Most commonly used antibiotics are 1% tetracycline ointment or 1% erythromycin ointment. Tertiary prevention. Disability limitation, corrective surgery may be required in case eyelash turns inward. Immediate corrective surgery is required to prevent blindness, and rehabilitation in cases where blindness has occurred. We can do vocational rehabilitation. Updates. WHO has adopted a SAFE strategy, which is a prophylaxis against trachoma infection and prevention of blindness. SAFE strategy was launched in 1993 by WHO. Now, SAFE, S stands for surgery, A, antibiotic use, F, face hygiene, E is the environmental changes. Um, Surgery is done to treat the blinding stage, which is trachomatis tracheasis. Antibiotics are given to clear infection, particularly mass drug administration of the antibiotic erythromycin, which is donated for elimination programs. Facial cleanliness and environmental improvement, particularly improving access to water and sanitation, as it has been seen that communities with safe water supply have decreased incidence of this disease. After SAFE strategy, GET, Global Elimination of Trachoma by 2020, in 1996, WHO launched a WHO Alliance for Global Elimination of Trachoma by 2020. This alliance is a partnership which supports implementation of the SAFE strategy by member states and strengthening the national capacity through epidemiological surveys, monitoring, surveillance, project evaluation, and resource mobilization. A WHO goal is to eliminate trachoma as a public health problem by the year 2020. Elimination of a trachoma as a public health problem, as defined by WHO, is reduction of the prevalence of trichiasis to less than 1 per thousand total population, and reduction in the prevalence of active trachoma sign TF in children aged 1 to 9 years to less than 5%. Eliminating trachoma, WHO announces sustained progress with hundreds of millions of people no longer at risk of infection. What have we achieved? Reduced the number of people at risk of blindness from trachoma from 1.5 billion in 2002 to under 137 million in May 2020, which is a 91% decrease. And in 2020, 13 countries have reported achieving elimination goals, and 10 of those countries have been validated by WHO as being eliminated trachoma as public health problems. These countries are Cambodia, China, Islamic Republic of Iran, Laos People Democratic Republic, Ghana, Mexico, Morocco, Myanmar, Nepal, and Oman. We have not achieved the elimination in rest of the countries as a public health problem. So next target is 2030 to eliminate trachoma as a public health problem. World Sight Day is celebrated every second Thursday of October, which is a global event meant to draw attention on blindness and visual impairment. In 2020, the theme of the World Sight Day was Hope in Sight, and trachoma has achieved is included in the priority diseases included in the World Sight Day. Vision 2020 is a global initiative that aims to eliminate avoidable blindness by the year 2020. It was launched in 1999 by WHO and 20 international NGOs. And trachoma has also achieved, trachoma is also in priority in Vision 2020 to eliminate the main causes of preventable and treating blindness as a public health problem. In Pakistan, an estimated 4 million people live in trachoma endemic areas across 4 provinces of Pakistan, and that active trachoma is confirmed in 5 districts with over 26,954 people in advanced stage of disease. For eliminating trachoma in Pakistan, there is Pakistan Trachoma Elimination Project, which is a drive to eliminate trachoma as a disease in Pakistan. Trachoma Safe Strategy 1996 to 2020 Pakistan Trachoma Elimination Project is a complementary initiative by Fred Hollows Foundation with the financial support from DFID towards the GOP's program for the elimination of trachoma in Pakistan as a public health problem. Discussing about the vaccine, currently there is no recommended vaccine for the chlamydia. Trials are still in progress. Facilitating research for trachoma elimination. International commitment to eliminate trachoma as a public health problem is demonstrated by the resolution by WHO. However, trachoma has been labeled as neglected tropical disease in part because research on trachoma has historically been given insufficient attention in proportion to its contribution over overall human suffering. Summarizing today's lecture, trachoma, our target is to defeat the world's leading infectious cause of blindness, and target is to eliminate as a public health problem. In 2002, there were 1.5 billion at risk from trachoma, fell to 137 million in 2020, which is a 91% reduction. 74% reduction in number of people with advanced disease. 10 countries have been validated by WHO for achieving elimination. This is a public health problem in 44 countries. An estimated 137 million people are at risk in endemic countries, has visually impaired and blinded 1.9 million. Africa is the most affected continent. Women need surgery for advanced disease up to 4 more times as offered to men because women have more interaction with the children. The disease, it is caused by the chlamydia trachomatis, transmitted from person to person. Multiple infections lead to visual impairment and blindness. Blindness from trachoma is irreversible. Elimination strategy developed by WHO is a safe strategy, surgery for advanced case, antibiotics to clear infection, facial cleanliness, improved hygiene, environmental hygiene to reduce transmission. Now it's MCQ's time. Which of the following disease is the most common preventable cause of blindness?
Trachoma.
Yes, B is the correct answer, trachoma. Elimination of trachoma as a public health problem is defined as less than 1% prevalence of trachomatis inflammation in children aged 1 to 9 years age. Less than yes, the correct answer is C. Less than 5% prevalence of trachomatis inflammation in children aged 1 to 9 years old. Most common source of transmission of type 3 is
Eye discharge.
Yes, it's B, eye discharges. Safe strategy to eliminate trachoma by 2020. Yes. Susceptible age for acquiring trachoma is
2 to 5 years.
2 to 5 years is the most common age for acquiring trachoma. All ages are susceptible for getting infection. So the correct answer is B. Chlamydia trachomatis is gram positive.
Obligate intracellular.
Yes, the correct answer is obligate intracellular bacteria. A 4-year boy came with symptoms of itching and
Trachoma.
lacrimation. The
Trachoma
patient
A.
has conjunctival follicles. So, yes, the correct answer is trachoma because conjunctival follicles are diagnostic for trachoma. Which of the following patients with trachoma, as defined by WHO grading system, are at highest risk of blindness?
C. Trichiasis wale.
Yes, patients with trachomatis
Trachomatis
tracheasis, which have
tracheasis.
inverted eyelids, are at highest risk of blindness. And trachoma is a Greek word which means
Rough C.
C, rough. Currently, trachoma is a public health problem
44
in
countries.
44 countries. Correct answer.
Thank you
These
very
are
much,
the
Dr. Mehri.
references.
Very nice. I hope you can have my voice very clear and audible. Am I clear and audible?
Yes, ma'am.
Right. Okay. It is a wonderful presentation, and I must appreciate the effort of Dr. Mehreen that she has put in because trachoma is a very complicated topic. It has many facets, including pathology, eye, and community medicine, and how beautifully it has been presented. I am really looking forward to the similar presentations in future too. As it has been said that the target by 2030 is having elimination of trachoma from this world. And the safe strategy of WHO is very important. S stands for surgery, A for antibiotics, F for facial cleanliness, and E for environment. As we know that most of the people, they must have a minimum daily facial wash more than 5 times. So the minimum requirement is we 5 times facial wash with plenty of water and soap. Another important thing is, as it has been presented, that it is through physical examination that diagnosis is made. Now, my question is, pathology is a very important part of trachoma. Then why physical examination is required for diagnosis of trachoma? Lab tests are, why not it is being used for trachoma diagnosis? Anybody from the class? Dr. Mehreen?
Ma'am, because clinical signs are very specific with this disease, the follicle, conjunctival follicle.
The reason is because we know that Trachomatis chlamydia trachomatis is an obligate intracellular bacterium, and the lab tests that are not available in the places where trachoma is very common. As we know, trachoma is a disease of the poorest of the poor, overcrowded people with less hygiene, and here the obligate intracellular bacterium required very sophisticated tests, especially intracellular growth of the bacteria in different cells. That is only possible for the 100% diagnosis of chlamydia. The ELISA test and other tests that are being used, they are giving lesser sensitivity and specificity rather than intracellular growth of culture of chlamydia. Another important thing we know that it depends upon the stage of the disease, both the diagnosis as well as the treatment. So the stage of the disease, when it is a very advanced stage, please mute your mic. Everyone else, please mute your mic. So we have seen that the stage of the disease, that is a very advanced stage. It is very difficult to separate the intracellular bacterium chlamydia because in the later stages we have more complications, and there was inward movement of the eyelids that causes scratches over the sclera and conjunctiva. And at this stage, it is very difficult to remove the intracellular obligatory bacterium from the eyes that have complications. Moreover, we know that about 1.9 million people in the world, they have visual impairment or blindness. And please make it a point noted down that the blindness that is caused by trachoma, that is irreversible. Another important point is that there are 137 million people who live with trachoma in the endemic areas, and there are about 44 countries where it is a major public health problem. In 2020, as it has been presented, that WHO has declared the elimination year for trachoma. However, 13 countries in 2020 had reported achieving elimination goals. And these countries consisted of Cambodia, China, Gambia, Ghana, Iran, Iraq, Mexico, Morocco, Oman, Nepal, Myanmar. Do you think Pakistan is also included in that list, Dr. Mehreen?
No, ma'am.
No, yes. And whenever we say no, it is with a lot of sadness and lot of pain in our heart that we are not among these countries who have eliminated till 2020. We are still having trachoma. We are one of the countries that are endemic for it. And whenever we talk about South Asia, Central Africa, Central America, whole of Africa, South America, Australia, Middle East, where there is hyper endemic and elimination has not been achieved. And the next target is for 2030. We wish that in Pakistan should be in the list of the countries where the elimination has been achieved till 2030. We also know that the global level antibiotic coverage in 2019 was only 57%. So the antibiotic coverage that has to be increased. World Health Assembly 1998 adopted resolution for global elimination of trachoma, and still it is a dream. After so many years, we are still talking about the highest economic burden of any disease. And unfortunately, Pakistan is also one of those countries where elimination of trachoma has not been achieved so far. As it has been presented, the trachoma elimination for children, it has a different criteria as compared to the elimination of trachoma in adults. So my next question is, what is the criteria for elimination of trachoma in adults? Adults, I mean more than 15 years of age. Anybody from the class?
Ma'am, reduction of trachomatis tracheasis to less than 1 in 1,000 persons.
Very nice. It is the elimination of trachoma would be set when it is less than 0.2% or one case per 1,000 in adult population that is greater than 15 years. So you should make it another point that before 15, we have a different criteria, and after 15, we have different criteria for elimination. Elimination is not synonym with eradication, and we would discuss it more in our coming lectures that what are different elimination strategies and how they are different from our eradication strategies. And the most important point that has to be noted today, if you have noted that point, that is the greatest achievement for today's lecture. The trachoma must be eliminated through safe strategy, and safe S stands for surgery, A for antibiotics, F for facial cleanliness, E for environment. And the take home message is that only 57% people globally till 2019 has antibiotic coverage. So it has to be increased. It has to be scaled up. The facial cleanliness, it should be more than 5 times a day, just like we do our washing of the hands. The facial washing is necessary. Facial wash should be more than 5 times a day. And this is one of the key message for today. Thank you very much. If you have any question, you are most welcome to ask. Okay. Allah Hafiz. Best of luck.